Greetings and welcome to Ask the Doc. My name is Adrienne Houghton and I am with Dr. Waqis Ahmed. And we are going to be talking today to Dr. Barbara Pickut, who is a NeuroX physician. And the first thing I'd like to say is welcome, Dr. Pickut, to the studio. And you are a world expert in Parkinson's disease, I believe. So perhaps would you like to tell us a little bit about your skills?
Yes, thank you. Thank you very much. Yeah. Hello, everyone. Well, as Adrienne introduced, I'm a neurologist, MD, and I also studied public health. So I was studying public health in terms of health prevention and wellness. I have had the opportunity to specialize in neurodegenerative diseases, such as Parkinsonism. Also, the interventions in Parkinsonism, including medications, for example, going all the way to surgery for people with Parkinson's. We also have studied a number of non-pharmacological interventions in Parkinson's, and that fits into the specialty that I also have, and that's neurorehabilitation.
Thank you, Dr. Pickut. Tell us more about how did you hear about NeuroX and what is the vision for your specialty you can achieve with NeuroX?
Thank you, Dr. Waqis. Well, it's a very important evolution for us, I think, in medicine that we have telehealth. We can reach people much more easily in their homes. We seem to see that the stress level for many people is lower when they're able to meet the physician or provider, healthcare provider within their own home. Another advantage that we see is that we often have the care partners or the family participating in the consultations or in the interviews. And this is quite helpful both for the patient and for the provider in terms of getting information, the correct information, being able to verify information with the people who are helping take care of the patient. So personally, in our subspecialty, I find this to be a great advantage for everyone.
Thank you.
Have there been any new developments within your particular area of expertise that has been useful for you with NeuroX?
I think that some important developments have occurred over the last years. You know, that the number of people with Parkinson's is actually exponentially growing. We're looking to go from approximately 6.4 million in the world to a doubling in 2040 to over 14 million people. So the advantage and the importance of, in my mind, for NeuroX is to be able to reach all these people who are suffering and who need help that maybe otherwise live geographically too far away from expertise. So NeuroX is a way to help get these important providers that we have on staff at NeuroX to people with this growing need. There are developments within the movement disorders using devices such as a smart watch to be able to measure changes in people's movement as a function of having taken medication. So there are ways that we can actually examine people through the computer.
No, thank you. I think you just answered my next question because from a physician perspective, some of the physicians may think that, how neurology patients can be seen remotely, you need to do a physics examination. But as you mentioned, with the NeuroX technology, those patients can be not only examined, but we can also monitor them, the clinical diagnosis there. They also want to see about the diagnosis and treatment. I know there are different options, your medications options, but from the patient's perspective, when they should seek an expert second opinion services?
Yes, thank you. That's a very important question. I would say, if I can give you a preamble a little bit to that, and one is a preface. One is that I think that people with certain symptoms that look like Parkinson's, that is, if a tremor, not all people have tremor, some slowness of movement, some difficulty doing fine motor things, difficulty with gait and posture. Those are all things that point toward Parkinsonism. And I think even at that point, expert advice should be sought because there is a large number of diagnoses under the term Parkinsonism, and Parkinson's disease is only one of them. So if there's any doubt, if one has a patient that has slowed in movement, doesn't need to have a tremor. 1/3 of the people with Parkinson's disease have no tremor, so that brings doubt in clinicians' minds. Stiffness of muscle and postural instability, again, those are the things that sometimes we need to get another opinion on because the treatment can be very different.
Thank you.
I'd like to ask you a question about your mindful meditation. Can you tell us exactly what that is?
Yes, so in that whole, it's a complementary therapy, and it can be considered to be within the integrative medicine. And integrative medicine seeks to provide the best evidence and the broadest choice of therapy for patients. So there is clinical evidence, and there is imaging evidence that techniques or studies or trainings such as yoga or mindfulness can actually change the brain and help restore health, giving people a feeling of living within their body, understanding symptoms, being able to better report their symptoms to their clinician, enjoy general better health. So the difference between mindfulness and yoga is in some ways blurred. In mindfulness training, one learns 3 techniques, if I can call it that. One is yoga. The other is mindfulness or meditation, or being able to view one's thoughts and emotions as events rather than being overwhelmed by them. And the other is called a body scan, where we do sort of a sensory training with people. And people are given these techniques and they practice at home. And there's, in some ways, little distinction between that and some forms of yoga.
Thank you, Dr. Pickut. So it's been very helpful, and I'll close this short session by asking, what is your message for the young, newly trained physician, neurology, or who are in the residents who wants to actually go into like this fellowship for the Parkinson disease? What's your message for them so to get into this specialty?
Well, I would say welcome, that it's a very interesting time to become involved in movement disorders fellowships. There are developments going on in medication over the last 3 years that have been phenomenal. We're working out of the dopaminergic system now and looking at other systems such as adenosine that we know are changed both in Parkinson's and Alzheimer's and in neurodegeneration. There are advances in deep brain stimulation surgery, great advances, allowing us to pinpoint more exactly in the brain where we're stimulating and how much power we're using to stimulate. There are advances in non-pharmacological therapies such as yoga. There was a publication in the JAMA just recently about yoga and people with Parkinson's. It's just an exciting time. I think it's a wonderful time. We're starting to be able to help these people who up until now were difficult to manage.
And it's amazing how utilization of technology, you can have an outreach of super specialists like yourself around the globe. So thank you for all you're doing for the patients, and thank you for your time today.
Thank you, Dr. Pickut, and it was an absolute pleasure to talk to you.